Hello everyone, I am Dr. Deepak Yadav, a heart and lung transplant physical therapist. I am currently working as an assistant professor at Dolphin PG Institute of Biomedical and Natural Sciences. Before I begin, I would like to dedicate this lecture to my teacher, Dr. Deepti Variko, whose guidance and inspiration have played a vital role in shaping my understanding of this subject. Her mentorship continues to influence my academic journey deeply. I would also take a moment to dedicate this lecture to Dr. Manmeet Kaur. Her unwavering support and passion for teaching have been a constant source of motivation for me. This presentation is a reflection of the knowledge and values they both have instilled in me. So, to proceed with, we are going to cover breathing difficulties, first aid, prevention, and its management. So, what are the learning objectives? By the end of this session, you will be able to recognize the signs of breathing distress and to identify early and late symptoms, including abnormal breathing sounds, posture changes, and cyanosis. Moreover, you'll be able to apply appropriate first aid techniques and to perform initial assessment, assist with inhalers or epinephrine, and provide care for choking and respiratory arrest. Last but not the least, you'll be able to understand prevention and basic management strategies. Also, you'll be able to implement lifestyle adjustments, manage chronic conditions, and know when to seek emergency help. As we all know, breathing is a vital function that supplies the body with oxygen and removes carbon dioxide. When this process is disrupted, whether due to illness, injury, or obstruction, it can lead to breathing difficulties, which can range from mild shortness of breath to complete respiratory failure. In other terms, breathing difficulties can also be known as dyspnea or shortness of breath. It is inadequate or abnormal breathing effort. Breathing problems can arise suddenly, such as during an asthma attack or choking incident, or develop gradually in conditions like COPD. Regardless of this cause, breathing difficulties are a medical emergency when they interfere with oxygen delivery to the brain and the other organs. Recognizing the signs early and taking appropriate first aid measures can prevent deterioration, reduce complications, and save lives. In the context of basic life support, that is BLS, quick action in response to breathing issues is often the difference between life and death. Proceeding with causes of breathing difficulties. Lung conditions that can cause breathing difficulty are asthma, pneumonia, COPD, pulmonary embolism, pulmonary hypertension, croup, and epiglottitis. Now we will discuss each of these factors. So first one is asthma. Asthma is an inflammation and narrowing of the airways that can cause shortness of breath, wheezing, chest tightness, or coughing. It is a common condition that can range in severity. Next one is pneumonia. So pneumonia is a lung infection that can cause inflammation and a buildup of fluid and pus in the lung. Most types are contagious. Pneumonia can be a life-threatening condition, so prompt treatment is important. The symptoms may include shortness of breath, cough, chest pain, chills, sweating, fever, muscle pain, and exhaustion. Next is COPD, that is chronic obstructive pulmonary disease. It refers to a group of diseases that lead to poor lung function. Other signs and symptoms include wheezing, a constant cough, increased mucus production, low oxygen levels, and chest tightness. Emphysema, often caused by years of smoking, is in this category of diseases. Next lung condition that can cause breathing difficulty is pulmonary embolism. So, a pulmonary embolism is a blockage in one or more of the arteries leading to the lungs. This is often the result of a blood clot from elsewhere in the body, like the leg or pelvis, traveling up to the lung. This can be life threatening and it requires immediate medical attention. The symptoms include swelling of the leg, chest pain, cough, wheezing, profuse sweating, abnormal heart rate, dizziness, loss of consciousness, and a bluish tint to the skin. Next is pulmonary hypertension. Pulmonary hypertension is the high blood pressure that affects the arteries in the lungs. This condition is often due to the narrowing or hardening of these arteries and can lead to heart failure. Symptoms of this condition often start with chest pain, shortness of breath, trouble exercising, and extreme tiredness. Later on, symptoms can be very similar to those of a pulmonary embolism. Most people with this condition will notice worsening shortness of breath over time. Chest pain, shortness of breath, or loss of consciousness are symptoms that require emergency medical attention. The next factor is croup. It is a respiratory condition caused by an acute viral infection, which is known for causing a distinctive barking cough. Make an appointment with your doctor if you or your child has symptoms of croup. Children between 6 months old and 3 years old are most susceptible to this condition. Next is epiglottitis. It is a swelling of the tissue that covers your windpipe due to infection. This is a potentially life threatening disease that requires immediate medical attention. The symptoms include fever, sore throat, drooling, blue skin, difficulty breathing and swallowing, strange breathing sounds, chills, and hoarseness. One common cause of epiglottitis may be prevented by a Haemophilus influenzae type B vaccination. This vaccine is generally only given to children under the age of 5, as adults are less likely to get a hip infection. Now, the heart conditions that can cause breathing difficulty. You may notice yourself feeling out of breath more often if you have a heart condition. This is because your heart is struggling to pump oxygen rich blood to the rest of the body. There are a variety of possible conditions that can cause this problem. So, the first factor is coronary artery disease or CAD. It is a disease that causes the arteries that supply blood to the heart to narrow and harden. This condition leads to decreased blood flow to the heart, which can permanently damage the heart muscle. The signs and symptoms include chest pain and heart attack. Next factor is congenital heart disease. Sometimes this is known as congenital heart defects. It refers to the inherited problems with the structure and function of the heart. These problems can lead to breathing difficulty, breathlessness, or abnormal heart rhythms. Next is arrhythmia. Arrhythmia is abnormal heart rhythm and are types of irregular heartbeats affecting the heart rhythm or heart rate. It causes a heart to beat too fast or too slow. People with pre existing heart conditions are at higher risk for developing an arrhythmia. Going forward, the next factor is congestive heart failure. It occurs when the heart muscle becomes weak and unable to pump blood efficiently throughout the body. This often leads to a buildup of fluid in and around the lungs. Other causes of breathing difficulties can be environmental issues and hiatal hernia. The environmental factors can also affect breathing, such as allergies to dust, mold, or pollen. It can also be related to stress and anxiety and can be triggered with blocked air passages from a stuffy nose or throat phlegm. It can also be triggered via lowered oxygen intake from climbing to a high altitude. Hiatal hernia occurs when the upper part of the stomach protrudes through the diaphragm into the chest. People with large hiatal hernias may also experience chest pain. So, who is at risk for breathing difficulties? You're at greater risk for breathing problems if you experience constant stress, have allergies, or have a chronic lung or heart condition. Obesity also increases the risk for breathing difficulties. Extreme physical exertion can also put you at risk for breathing problems, particularly when you exercise in intense or high altitudes. The primary symptom of breathing problems is feeling as though you can't breathe in enough oxygen. Some specific signs include a faster breathing rate, wheezing, blue fingernails or lips, a pale or gray complexion, excessive sweating, or flaring nostrils. Contact emergency services if your breathing difficulty comes on suddenly. Seek immediate medical attention for anyone whose breathing appears to have slowed considerably or stopped. After you have called 911, perform emergency CPR if you know how to do so. Some symptoms, along with breathing difficulty, can indicate a serious problem. These problems may indicate an angina attack, a lack of oxygen, or a heart attack. Symptoms to be aware of include fever, pain or pressure in the chest, wheezing, tightness in the throat, a barking cough, shortness of breath that requires you to sit up constantly, shortness of breath that wakes you up during night. The other possible symptoms are difficulty swallowing and heartburn. Medication and lifestyle changes can often treat small hiatal hernias. Larger hernias or smaller ones that don't respond to treatment may require surgery. Babies and young children often have breathing difficulties when they have respiratory viruses. Breathing symptoms often occur because small children don't know how to clear their noses and throats. There are several conditions that can lead to more severe breathing difficulties. Most children recover from these conditions with proper treatment. The first factor is croup. It is a respiratory illness usually caused by a virus. Children between the age of 6 months old and 3 years old are considered the most likely to get croup, but it can develop in older children. It usually begins with symptoms similar to a cold. The main symptom of the illness is a loud, barking cough. Breathing difficulties can result from the frequent coughing. This often occurs at night, with the first and second nights of coughing usually the worst. Most cases of croup resolves within a week. Some more serious cases may require emergency medical attention. The other factor is bronchiolitis. This is a viral lung infection that often affects babies younger than 6 months old. Respiratory syncytial virus is the most common cause of this problem. The illness may appear like the common cold at first, but in a few days it may be followed by coughing, rapid breathing, wheezing. Oxygen levels can become quite low and can require treatment in the hospital. In most cases, babies get well in 7 to 10 days. Your child needs medical attention if they have increased or persistent breathing difficulty. They may also require medical attention if they are taking more than 40 breaths per minute, or must sit up to breathe, or have retractions when the skin of the chest between the ribs and the neck sinks in with each breath. If your child has heart disease or was born prematurely, you should seek medical attention as soon as you notice they are having difficulty breathing. So, how do we do first aid response to breathing difficulties? The first step is primary assessment by DRSABC. This structured approach is used in basic life support to assess and respond to any emergency situation. D stands for danger. Ensure the area is safe for you, the victim, and any bystanders. Remove any hazards, for instance, traffic, fire, electrical risk, and do not put yourself at risk. The R stands for response. Check if the person is responsive. Tap their shoulder and shout, "Are you okay?" Look for verbal or physical responses. If unresponsive, proceed immediately to the next steps. S stands for shout for help. Call for emergency medical services or ask a bystander to do so. If you're alone and have a phone, call immediately or activate emergency services via speakerphone. Next, A stands for airway. Open the airway using the head tilt chin lift technique, unless spinal injury is suspected. Check for obstructions like food, vomit, or swelling. If visible, gently remove the obstruction with a finger sweep, only if trained and it's safe to do so. Now, B stands for breathing. Look, listen, and feel for breathing for more than 10 seconds. Look for chest movements and listen for breath sounds. Also, feel for air on your cheek. If the person is breathing normally, continue monitoring. If not breathing or only gasping, begin CPR. Next, C stands for CPR, that is cardiopulmonary resuscitation. If no breathing and no pulse, begin chest compressions. Push hard and fast in the center of the chest at the rate of 100 to 120 per minute. The depth should be about 5 to 6 cm for adults. If trained, provide 30 compressions and 2 rescue breaths. Also, use an AED, that is automated external defibrillator if available. Now, initial steps if the person is breathing but in distress. First and foremost, reassure the patient. Anxiety can worsen breathing difficulties. Stay calm, speak gently, and encourage slow, deep breaths. Positioning. Help them sit upright or in a position they find comfortable. Sitting upright often makes breathing easier, lying flat may worsen distress. Next is to monitor and call EMS. Even if they seem stable, breathing problems can escalate quickly. Call for emergency help if their condition worsens, or they have a history of serious respiratory conditions, or if there's any sign of confusion, bluish lips, or fatigue. If breathing stops, immediately start CPR if the person becomes unresponsive and isn't breathing. If you're trained, give rescue breaths. After 30 compressions, give 2 slow breaths about 1 second each. Watch for chest rise and continue CPR until EMS arrives or the person starts breathing again. Now, we will be learning about the first aid in specific scenarios such as asthma attack or anaphylaxis. In asthma attack, help them use the reliever inhaler. Use a spacer if available, or the standard protocol is 4 puffs, wait 4 minutes, and repeat if needed. Follow their asthma action plan if they have one. Also, call EMS if no improvement after using inhaler is seen, or they are unable to speak in full sentences, or they became exhausted or drowsy. In anaphylaxis, that is severe allergic reactions, the symptoms can be swelling of lips, tongue, difficulty breathing, hives, rapid pulse, dizziness. Use an epinephrine auto-injector immediately. For example, EpiPen. Inject into the outer thigh through clothing if necessary, and hold for 3 to 10 seconds depending upon the brand. Call EMS immediately. If no improvement in 5 to 15 minutes and another injector is available, give a second dose. In case of choking to conscious adult or child, encourage them to cough forcefully if they can. If they cannot speak or cough or breathe, perform abdominal thrust, that is Heimlich maneuver. Stand behind them, wrap your arms around the waist, make a fist, place it above the navel, grab with your other hand and deliver quickly, inward and upward thrust until object is expelled or they lose consciousness. In case of unconscious choking victim, begin CPR immediately. After each set of compressions, open the mouth and check for visible obstruction. If you see an object and can safely remove it, do so. And then continue CPR and rescue breaths if trained, checking airway each time. Coming to the prevention strategies. Preventing breathing problems is often more effective and safer than responding to them during a crisis. Many respiratory emergencies are avoidable with proper precautions, lifestyle habits, and education. Here's how prevention plays a key role. Avoid exposure to triggers. Breathing difficulties are often caused or worsened by specific environmental or behavioral triggers. Reducing exposure can significantly lower risk. Some of the factors can be allergens, such as pollen, dust mites, mold, pet dander. Other factors can be irritants, such as cigarette smoke, pollution, chemical fumes. Cold air can also trigger these factors. It can provoke asthma or other respiratory issues. People who are prone for exercise induced asthma should avoid exercises without preparation. So, how do we prevent it? Use air purifiers indoors and avoid smoking or second-hand smoke. Wear masks or scarves in cold weather and keep windows closed during high pollen days. Now, manage chronic conditions properly. Individuals with asthma, COPD, or heart failure must maintain good disease control to prevent acute episodes. They should take medications regularly as prescribed, for instance, inhalers and steroids. They should follow action plans provided by the healthcare professionals and attend regular checkups to monitor lung function and adjustment treatment. Next is vaccinations. Respiratory infections can be severe, especially in vulnerable individuals. Pneumococcal pneumonia and COVID-19. These vaccines help reduce the chance of complications like pneumonia or bronchitis. Now, the fourth point is educate and train. Public education on how to recognize early signs of respiratory distress should be taught. Train individuals in BLS and first aid so they can respond appropriately to emergencies. Also, teach children and caregivers about choking hazards and asthma management. Next is safe living and working environments. Always ensure good ventilation in homes and workplaces. Use protective equipments like masks or respirators in dusty or chemical heavy environments. Maintain good hygiene to prevent spread of infections by hand washing, covering coughs. The last point is healthy lifestyle choices. Maintain a healthy weight as obesity can strain the lungs. Exercise regularly to strengthen the lungs and cardiovascular system. Also, eat a balanced diet rich in antioxidants and anti-inflammatory foods. Moreover, avoid alcohol and drugs that may suppress breathing. Last but not the least, prevent choking, especially in children and elderly. Cut food into small pieces for children and elderly people. Supervise meals for those with swallowing difficulties. Avoid giving small, hard foods such as nuts, popcorns, hard candy to toddlers. And educate on safe eating habits, for instance, no talking or laughing with a full mouth. Breathing difficulties can escalate rapidly, so knowing when to escalate care and how to manage the condition over time is critical for patient safety and long term health. You should always know when to call emergency services. Immediate medical attention is necessary when certain danger signs appear. These are red flags that indicate the body isn't getting enough oxygen or the condition is worsening. Call for help if breathing becomes extremely difficult or noisy. Gasping, wheezing, or struggling for each breath can be a sign. Call for help if lips, face, or fingernails turn blue or gray. That shows cyanosis. It is a sign of inadequate oxygenation. Again, call for help if the person becomes confused, drowsy, or unresponsive. That indicates the brain may not be getting enough oxygen. Moreover, you may also call for help if there is no improvement after usual treatment. For instance, asthma attack not relieved by inhaler. If there are signs of severe allergic reactions, that is anaphylaxis, you should also call for help because swelling, rash, trouble breathing, rapid heartbeat is the significant clinical sign and symptom. Do not wait for symptoms to worsen. Early activation of EMS can be life saving. Now, ongoing care and long term management. Let's talk about it. Even after the immediate episode is managed, long term support is essential to prevent recurrence and promote respiratory health. Encourage use of asthma or COPD management plans. Patients with chronic respiratory conditions should follow written action plans for their health from their healthcare providers. They should track symptoms and use peak flow meters if advised, and adjust medications as per plan when symptoms increase. Referral to healthcare providers. After a breathing emergency, follow up is vital. Primary care or respiratory specialist for evaluation. Review medication, use an inhaler technique. Also, investigate underlying causes, for instance, allergies and infections. Promote BLS and first aid training. Encourage patients, families, and caregivers to learn BLS and first aid, especially for asthma, choking, and allergic reactions. know how to use devices like inhalers, spacers, and epinephrine auto-injectors. They should be prepared for emergencies at home, school, or work. So, what did we learn? Early recognition, prompt first aid, and proper ongoing management of breathing difficulties can prevent emergencies, reduce complications, and save lives. Every second counts when breathing is compromised. So, the presentation is over. I hope you liked my lecture. In case you have any doubts or queries, you can directly mail me. I'll be happy to receive your emails. My email ID is deepakyadav.physiotherapy@dolphininstitute.in. My Instagram handle is physio_preacher. Also, you can follow me on my LinkedIn and Twitter account. Thank you so much. Have a great day.